Okay, so talk is entitled "Is Obesity Driving the Surge in Atrial Fibrillation?" So, WHO classification for obesity is those above 30 kilograms per meter squared are defined as being obese, and those below 25 are classified as being normal. In between are overweights, but of course we saw a study mentioned earlier on from the Japanese cohort, which seems to have different definition. So if we look at this paper, which was alluded to a number of times this morning, this famous paper by Wang et al. Published in JAMA about a decade ago, because over the past decade we've been increasingly recognizing the potential importance of obesity in relation to atrial fibrillation. And this paper looked at over 5,000 participants and followed them up for nearly 14 to 15 years. And what they showed was that there was a significant increased probability of developing atrial fibrillation in those who were obese compared to those who were not obese. And this was present in both men and women. And what they concluded was that for every unit increase in the BMI, there is a 4% increased risk of developing atrial fibrillation. However, when they looked at the potentially confounding variable of left atrial dilatation, there was a strong correlation between increased left atrial dilatation and development of atrial fibrillation, giving rise to the question, is it really obesity or is it the left atrial dilatation? A year later, Frost and colleagues published this very large Danish registry of nearly 50,000 participants who were followed up for nearly 6 years. And exclusion criteria were any of those who had cardiovascular disease, but not those who had hypertension. So hypertensive patients were included in this study. And what they showed was that, again, for both men and women, there was a significant increased risk of developing atrial fibrillation in those who are obese compared to those who are not obese. So, and they concluded that, similar to the other paper, that there is now around 7% increased risk of developing AF for every unit rise in BMI. A few years later, this meta-analysis by Wanahita and colleagues looked at these 5 large studies amounting to about 80,000 patients, and what they found was that there was overall 49% increased risk of developing atrial fibrillation in those who are obese compared to those who are not. Remember that the percentages here are different because this is overall, not per unit rise in BMI. And this paper came out last year looking at obesity and atrial fibrillation, looking at some electrophysiological parameters. And they looked at ERPs in the right atria, left atria, proximal left superior pulmonary vein and distal left superior pulmonary vein. They focused on the left superior pulmonary vein in order to keep the investigation as minimal as possible. So, and what they found was that those who were obese had lower ERPs in the left atria and in the left superior pulmonary veins compared to those who had normal weights. And as we heard earlier, Dr. Darbar was saying that the lower the ERP and action potential duration, the greater the risk of atrial fibrillation. They also looked at other parameters, including LV-EDP, and found that this was elevated in obese patients, as was the mean atrial pressure. And they also found, which isn't shown here, that left atrial contractility was reduced in these patients who were obese. So the potential mechanisms were thought to be a rise in plasma volume diastolic dysfunction in the left ventricle, neurohormonal activation. We heard about the natriuretic peptide cytokines, that these may all contribute to raising left atrial pressure and therefore increasing the left atrial dimensions. But the question still remains, is it this as opposed to this, or the other way around, or both? So we've known for quite some time that birth weight correlates very strongly to weight in adulthood. So here we have the 5 categories of birth weights here, and in adult life the BMI increases as we increase from birth weight. So a study undertaken by Conan and colleagues looked at whether birth weight was related to atrial fibrillation, and they looked at nearly 30,000 healthy women who are above 45 years of age. They followed them up for nearly 15 years and divided them by 5 birth weight categories, ranging from under 2.5 kilos at birth to over 4.5 kilos at birth. And what they found was that there was a strong correlation between birth weight and development of atrial fibrillation. And this was also statistically significant when they adjusted for a number of other conditions. So we move on to obstructive sleep apnea, because we've got some data on obesity and birth weight. What about obstructive sleep apnea? Well, this study looked at 3,500 patients and followed them up for nearly 5 years, and showed very clearly that those who had obstructive sleep apnea were at greater risk of developing atrial fibrillation than those who did not. And this was specifically in those who were aged under 65. This did not hold true for those who were above 65. And interestingly, this was independent of obesity. So if we look at these green bars here, which are the obese patients, they have an increased risk of developing AF as the obstructive sleep apnea gets worse or is more severe. And that's also the case in the overweight patients who are in red. So independent of obesity. So we know that there is we discussed earlier on, this overlap between these conditions. It's a complex situation, obesity, all the metabolic conditions of obstructive sleep apnea and atrial fibrillation. So it appears to come down to, at some stage, fibrosis within the atria, at least in a lot of the studies that fibrosis has been looked at. And tomorrow we have a presentation from Dr. Chan who will go into more detail on that. So is it obesity? Is it left atrial dilatation? We've got some more insight into this recently, and that's with looking at pericardial fat and atrial fibrillation. And here in this paper they identified the pericardial fat by MRI scans. Here is around the atria, and actually this image hasn't come out, but this was originally the ventricle, and also around the ventricle they looked at the images and they artificially coloured these in as the pericardial fat areas. Now in another study they took CT scans in 273 patients to assess their pericardial fat volume, and what they showed very clearly was that pericardial fat correlates with the different types of atrial fibrillation. So having greater amount of pericardial fat appeared to relate to whether you have paroxysmal or persistent atrial fibrillation. And interestingly, for the first time, this was independent of left atrial size and BMI. So we've got a bit more insight now. Coming back to this study which I showed the MRI images on, they did CMR scans to assess pericardial fat in 130 patients, 110 of whom had atrial fibrillation going for ablation, and 20 controls in sinus rhythm. And what they showed was that, again, pericardial fat correlates very well with atrial fibrillation. But now, not just the atrial fibrillation, but the severity of the atrial fibrillation. So if we look at this graph here, this is total pericardial fat. This is the volume, and these are the different types of atrial fibrillation: sinus rhythm, paroxysmal persistent and persistent and permanent atrial fibrillation. As you go along these categories, the level of pericardial fat increases significantly and amongst all of these groups. And that was also similar for periventricular fat, less so for periatrial fat, but still in the same direction. So the question has arisen more recently as to whether this is now not a systemic issue from obesity, but instead perhaps a more local inflammatory reactive problem with cytokines and fibroblasts that Dr. Daba alluded to earlier. And also, interestingly, they looked at patients who had an ablation. So these 110 patients, they had the ablation. They found that those who had the greatest level of success in this solid black line were the ones who had the minimal amounts of pericardial fat, whereas those who had significantly larger amounts of pericardial fat fared worse in terms of outcome from ablation. So, to summarize, there is a strong correlation, there does appear to be a strong correlation between obesity and developing atrial fibrillation, but whether it is causal is in question, and it may actually be the left atrial dilatation that is the link, and more recently the data suggests that it may be even much more local pericardial inflammatory reaction that is causing the atrial fibrillation. Thank you very much for your interest.